Welcome to another edition of the Small Caps podcast. I'm Peter Capsanis. Well, how would you feel if your local podiatrist, dentist, or physiotherapist was part of an allied health group that was listed on the stock exchange? Would you care? Would you invest? What kind of better or stronger outcomes would it mean for the practice and for you as the patient? Well, according to Advent Health Limited, this is the future. The company is in the middle of an initial public offering and is expected to list on the ASX by mid-July. According to its prospectus, Advent Health is Australia's truly multidisciplinary allied health business, providing better outcomes for patients. To tell us more, I'm joined by the company's CEO, Cris Massis. Cris, good to have your company.
Thanks, Peter. Nice to be with you on the podcast.
Fantastic. Cris, so as I understand it, you're effectively rounding up a group of health practices to become a big multidisciplinary unit. How many clinicians in total and practices are we talking about?
Yeah, look, Advent Health is a consolidation of what we term 12 vendors, but over 59 locations and over 300 clinicians in our network. And this is part of what we refer to as our founding group. We have vendors in the majority of states across the country, with obviously an eastern seaboard dominance where the main population is.
Okay, so across what allied health services specifically? I mean, I mentioned the type of services, your dentist, your physio, your podiatry, but we're not talking about your local down the road single operators, are we? We're talking about almost existing allied hubs in themselves, so to speak. Is that right?
Spot on. I think one of the, hallmarks of the design of our organisation is that Advent Health is what we term a group of groups. So, and there's an important reason why we've designed the organisation that way. In a previous role, I commissioned some research on what a future healthcare practice should look like. And there are many elements that came out of that research which have been fundamental in the design of our organisation. A couple of those things are future healthcare business should be clinically led. So critical that the clinicians are on the front line. There is a clinical governance process and overlay to ensure that evidence and patient outcomes are at the leading edge. It's consumer focused. So actually working with your health consumer, ensuring that any healthcare is co-designed, not necessarily a command control model. Tech enabled, and we know that digital disruption is everywhere, but I feel the healthcare sector is still at the start of a digital or tech disruption. And your point earlier around not an avoidance, but steering away from sole operators or sole practices. This research found that you need some size, scale, and footprint in order to work with large funders, whether they be the government, private health insurers, or compensable schemes. But probably the final element I'll talk to is what we term in the industry as a multidisciplinary offering. And for those that aren't aware of what allied health is, you think of medicine, you think of nursing, you think of pharmacy. All those other modalities are generally under the umbrella of allied health, and they include modalities like physiotherapy, chiropractic, exercise physiology, podiatry. If you look at the burden of disease in our community at the moment, many of them require multi-modalities. So if you look at heart disease or pain, musculoskeletal issues, arthritis, sports injuries, they need a number of therapies. But I think what stands us out from the crowd is we also have a mental health offering in a psychology business. So quite often when you look at a range of health issues in chronic disease, you would need usually a podiatrist, a dietitian, and quite often a psychologist and a physiotherapist. So what our aim is to offer that multidisciplinary offering with Advent Health across the country. And where healthcare is going, we have the bricks and mortar, obviously, but you've seen with COVID-19 and the uptake of what is termed telehealth. So healthcare via whether it be Zoom or iPhone or any other means. And certainly the health consumers have responded very well to that. So it's going to be a brave government that takes away that funding. So I think telehealth is here to stay. there may be some reforms from a funding point of view, but certainly the private health insurers, the compensable schemes, the NDIS, and Medicare and federal government have been fully supportive of telehealth. So we think healthcare will be part in the clinic, part virtual, part in the home, and part mobile. So it's really a hybrid offering, and I think that's what the consumers are expecting now and into the future.
So, in a nutshell, you're taking a group of businesses, some of them groups within groups, and putting it on floating it on the ASX. From a health perspective, Cris, how does this benefit the end user, which is the patient?
Yeah, look, great question. I think one of the critical elements that I mentioned earlier is around the clinical governance and clinical framework that any healthcare organisation has. We've been very determined and firm on having a clinical director on our executive team, so reporting into me, to make sure that all our clinicians in our network have the best training available, the ability to refer within the clinician network if there are any complex patients or any complex presentations, a standardized model of care for a range of conditions, but also having the number of clinicians and scale within our group. We can quite often have peer-to-peer support and for not only clinicians but also for graduates coming through. So we actually have a spectrum of clinicians available. So for us, having that skin in the game with our consumers and our patients and that clinical overlay is critical. The other corporate aspect, Peter, is the back end. And historically in smaller allied health practices, the technology is probably a little bit dated. The infrastructure is not there. And so things like patient records, clinical notes, even appointment services and rebooking and just the smart technology available through APIs and connectivity quite often are not in I guess, what I'd call a corner store allied health clinic. So again, the corporatization or the corporatizing of this sort of activity really creates a seamless patient experience to ensure that they're not always giving their name again or their details again, or I was here at a certain point in time. We'd like to bring all that smarts from a support central point of view and make sure that our vendors who are already on that journey are giving the best clinical care on the front line.
So, do you think that you'll be more competitive, I guess, as a group on the ASX? Obviously you'll have an obligation to your shareholders and your investors. Will your patients and your clients receive the same love?
Oh, without a doubt, it's central to what our value proposition will be. It's being a clinically focused, multidisciplinary model, but what that does actually drives organic growth and clinician retention. So for us, by doing our core business well, the growth will come. The sector itself is a massive sector, and quite often I refer to it as a sleeping giant. If you look at even if I give the recent examples of sitting on dining room tables, working from home, people in non-ergonomic chairs, people returning to sport, people suffering from isolation and anxiety. We had fires and floods at the start of the year. A lot of these things needed to be treated at an allied health practice with a whole range of modalities. The industry itself is growing between 3 and 3.5% a year. But our vendor group over the past 2 years, and we've been on the journey with them for a couple of years in terms of pre-integration work, they've been growing at 7%, so double the industry. So there is a high demand for organic growth. So our intent is to really grow additional services within our infrastructure, have some cross referrals using our multidisciplinary offering, and some vertical integration with an orthotics laboratory with our podiatry service.
Are we getting more injury prone? Are we getting more sicker as a nation? Are we seeing more cases of mental health cases of mental health rise more and more, which then I guess fuels the need for this, I guess, this consolidation of allied health services such as Advent Health?
Oh, that's a great question. I would argue that the stigma, if we take mental health as the example, I think the stigma of presenting and having an issue is dissipating. So you could argue that mental health issues, anxiety, mood, depression, has always been there, but probably for fear of stigmatization, people weren't getting the help they needed. I think with all the great work that Beyond Blue and Black Dog and all those like-minded organisations are doing in the mental health space, I think certainly people are getting their mental health plans and seeing their counsellors and psychologists. I think for the case of the manual therapies, certainly chronic disease, Peter, and diabetes and obesity. If you look at our, I guess, Western lifestyle, we have a good standard of living here in Australia, but I think with that comes other issues and mainly health issues when whether it be weight, and then with weight comes pressure on joints, and with that comes joint replacements. So it's a whole, roll-on effect. So certainly our health as a nation probably needs to be looked at, but certainly there are a lot of prevention wellness programs, not only rehabilitation, but in the allied health sector that can be done to prevent injuries, to prevent illness, and also to continue to be well throughout your lifespan.
Let me play the devil's advocate, Cris, on the next question. Are you going to be billed as the evil empire as as the consolidation grows? Are you going to pose more of a threat to those, as you said, those cornerstone vendors and allied health services? Do you pose a threat to those single operators, so to speak?
Certainly not a threat. I feel that our vendor selection has been quite disciplined. And why I say that is we're very firm on the design of the organization based on those successful elements I mentioned earlier. And so we actually have knocked back more vendors than perhaps what we've accepted in this initial tranche. So I think there is plenty of room in the market for not only small operators and boutique offerings, but certainly a large listed offering, but clinically led and multidisciplinary. So I think where we can add value and have an advantage is around the systems and the support and the working with our vendors who want to continue to grow but feel like they can't do that on their own. So these vendors are mid-career and have a real desire and want skin in the game to be part of the Advent Health journey to actually help grow. They have some great ideas and some great initiatives that we want to foster and flourish. And they are all aligned with our journey rather than, hoovering up widgets in a different sector. I think healthcare is personalised and unique and different, and we need to behave that way as a central support office.
If you're offering a range of allied health services under the one umbrella, can patients expect to receive, pay less?
I think different models in healthcare need to evolve. I think the fee for service model is something that is almost a dated concept. If you look at the way healthcare is funded by insurers and government, the fee for service piece will always be there, but I think they're looking at innovative ways to get value to get a patient better. So if you look at the subscription economy, you look at Netflix and Spotify, I think there is an argument that a membership model or a model of an episode of care is something that should be considered in healthcare. And there's certainly ways of looking at the way we engage with our patients. I don't think anyone's knocked it for six yet in healthcare. I think we're still grappling with capitation payments versus fee for service. But I think certainly you're onto a very critical point around what is the patient expecting? What are they wanting from an engagement from their allied health provider? So there may be a day where you buy a package of care, you get some in-clinic care, you get some remote monitoring on your phone around how you're moving or how you're rehabbing with some exercises. You might get a telehealth consultation in the evening after dinner with your physio or your podiatrist, and then you might get a check-in from your counsellor as well, and then you might close that off by another in visit, or a home visit. So for me, it's around what are we expecting in our lifestyles now of any products and services that we consume, and then how do we actually bring that to the healthcare consumer?
I mentioned that you're in an IPO at the moment. How are you tracking for mid-July, which I understand is the intended date?
We're going really well. We've got significant interest from institutional investors. Obviously, the market now, healthcare is a very exciting sector to be part of because of coming out of a pandemic announcement. So globally, health is considered a safe sector. Many of the investors, the feedback has they love the model of the small number of vendors, but the large number of locations. They're very impressed with our pre-integration work in terms of systems, IT systems, finance, and property and procurement. And the alignment of the vendors is a compelling story, and the growth opportunities. So with the narrative, it's been well received, and certainly we're on track for that for the mid-July listing.
What's the price entry point, so to speak?
It's a dollar per share. So 21 million shares at a dollar, and we hope to raise that. We've also got pre-approved bank debt, which again is another, I guess, a demonstration of due diligence. We've got an approved debt facility with the Commonwealth Bank for 12.2 million. So with the 21 million shares on offer and the 12.2, those funds sourced will be used to acquire the practices and the expenses of the offer, and the balance will be in working capital, which, as we know, healthcare businesses turnover revenue very, very quickly.
Your background, part of your background lies in sport. So do you think that sport clubs could be aligned with this type of model in the future? Would there be any benefit for both the sporting industry and the allied health services industry?
Look, certainly, and as you know, many, whether it be professional clubs or amateur clubs, have a range of allied health services already, whether it be exercise physiologists or physios or even dietitians now and podiatrists. And as you know, the professional sports sector have really invested heavily in mental wellness and mental health. So certainly they are happening. Pleasingly, many of our vendors already have those local relationships where we don't plan to rebrand everyone. I think for us, we understand that healthcare is very personalized, very community based, and very individualized. And so our vendors have established some amazing community partnerships, whether they be with schools or sporting clubs or local groups. So we really want to foster that, encourage that. So certainly they already have some of those relationships, but we will certainly encourage those because we think it needs to be a two-way street.
Well, Chris, it's definitely a fascinating concept, this concept of allied health services floating on the market. It's not something that you hear about every day. It's certainly not rocks or sands or stones or gas for that matter. So, by all means, good luck with the listing, and thanks very much for your time on the Small Caps podcast today.
Thanks for having me, Peter. I really appreciate it.